Hi everyone. Today we are going to learn about the facial muscle and one of the neck muscle, which we call a sternocleidomastoid. It's important for us to know the action of this muscle, location of this muscle, and the attachment of this muscle for doing the treatment, such as non-surgical facelift treatment and treatment that are involved in with muscle. First muscle is sternocleidomastoid, which is located on the neck area. Sternocleidomastoid, SCM muscle. The action of this muscle is to flex the neck and also rotate the head. And when you flex the head and rotate the neck, you are going to recognize the muscle. The two attachment, which is origin, is on sterno bone, and the other is on clavicle bone. The insertion is behind the ear, which called mastoid process of temporal bone. Next muscle is digastric muscle. Digastric muscle, the action of this muscle is to open the mouth and also stabilize the hyoid bone. The origin of this muscle is on mandible, and the insertion of the muscle is the tendon of hyoid bone. Next muscle is mentalis. Mentalis is muscle of the chin area. The action of this muscle is to elevate the skin and also produce the lower lip, bring the lower lip outward. The origin of this muscle is the mandible, and insertion of this muscle is around the skin of the chin area. Next muscle is depressor anguli oris. Oris is the mouth area. Depressor anguli oris. The action of this muscle is to depress the angle of the mouth. Origin of this muscle is mandible, and insertion of this muscle is to the corner of the mouth area. Next muscle is LEVATOR, LABII superior. LEVATOR, LABII superior is the muscle that is located on this area from here to here. And the action of the LEVATOR, LABII superior is to elevate the upper lip. And origin of this muscle is the orbital of margin of the eye in here, and the insertion is the skin of upper lip. Next muscle is orbicularis oris. Orbicularis oris, also known as kissing muscle. Action of this muscle is to puckers the mouth. Origin of this muscle is maxilla and mandible, and insertion of this muscle is the skin around the lip area. Next muscle that we need to know is a masseter. Is located right in here where my fingers are, and the action of this muscle is to close the jaw. The origin of this muscle is on zygomatics bone, which is zygomatic arch. The original is on zygomatic arch and maxilla in here. Insertion of this muscle is the mandible. Next muscle is buccinator. Action of this buccinator is to compress the cheeks against the teeth, and also is act as chewing and blowing act as chewing and blowing. The origin of this muscle is maxilla, and the insertion of this muscle is the fiber of orbicularis oris, the muscle of the mouth. Next muscle is frontalis. Frontalis is the muscle of the frontal bone. Action of this muscle to wrinkle the brow and also to rise the eyebrow. The origin of this muscle is the cranial, and the insertion of this muscle is the skin above the eyebrow. Next muscle is the zygomaticus muscle, which is muscle of zygomatic bone. We have two muscle of zygomaticus, minor and major. The insertion is on zygomatic bone. The origin is on zygomatic bone, and insertion is on the upper lip. Next muscle is procerus. Procerus muscle. Procerus is the muscle that is between the eyebrow, and this muscle is the action of this muscle is to draw the middle angle of the eyebrow. The origin of this muscle is lower part of the nasal, and the insertion of this muscle is the forehead between the eyebrow. Next muscle is orbicularis oculi. Orbicularis oculi is the muscle of the eye area. The action of this muscle is to close the eye, and the origin of this muscle is the frontal bone, and the insertion of this muscle is on this area of the eye, that loose part of the skin of the eye, which we call it palpebra. These were the muscles that you need to know for the face to do non-surgical facelift. And we are going to repeat these muscles again when I'm going to show you the actual, the practical part of this treatments of non-surgical facelift. And I'm going to show you that exactly again where the muscle are and how to use the machine to give lifting effect and penetration of the product. So we are going to be doing this on the practical part of the non-surgical facelift.